Hi, everybody. My name is Rob Cribb. In the meantime, I'm director of the Investigative Journalism Bureau and a reporter at the Toronto Star. So here's the problem with that data. It's secret. Never been made public. Never been. There's no central repository. It exists within each hospital. So each hospital surveys. The results go into a repository at that hospital. So you're already starting to see the problem, yeah? We have to get the data sets from each individual hospital. And so you go and you ask them, can we just have that data set? And you can imagine what the response to that question is, right? The next step, of course, is freedom of information requests. So, and there's, to be fair to them, there's tons of personal information in these records. These are individual patients of hospitals who are filling out a survey saying, I was in the hospital for these 3 days for the surgery, and they're asked to rate 20 questions or so, rate numbers. But the most important thing for me was, and this is so interesting, is it has a narrative field. So I got a copy of the survey. Always get a copy of the survey. The survey, the form surveys, everything. Those are databases, right? So I noticed that there was a free text field where people can not only just say, I get 3 out of 5, 2 out of 5, 1 out of 5. There's a text field. So they filled in, here's my experience. So these are narratives. So this is a database that combines data, huge numbers, right? We got 120,000 of these surveys. Woven into the numbers is narrative, heartbeats, stories, and not anecdotes, volume, by theme, by category. Hugely valuable. It's what hospitals pay millions of dollars for. Totally secret. You can't see it. Okay? So I took 2 or 3 kicks at the can with this and I failed. I got overwhelmed. It is a beast because the minute that FOI goes in, their first instinct is shut it down, right? So everything is a fight. And at some point, trying to do this as an individual, it's impossible. So I failed. And it wasn't until I was working with a team at the IJB, some of the best crack young reporters in this country, that we were able to, it took a village, essentially, to get it. So ultimately, we filed probably 100 requests. We got solid data from 50 hospitals, range from small, rural, to the biggest downtown hospitals on University Avenue. And compiled it. A lot of idiosyncrasies, very complex merging of all these data sets. But at the end of the day, we had a really valuable look behind the curtain of Ontario, the rubber hitting the road, so to speak, the actual patient experience out of their own mouths with detail, broken down with 20 questions and human heartbeat narratives. I'll show you a couple of examples of what it looks like. This is the comments. So you can see X's, so they obviously redacted names, tons of names of nurses and doctors and patients. And we had 120,000 of these. I read thousands. We had a team of students that I teach at TMU that spent time in this. I don't know how many we read. I don't think we read them all, but we read many, many thousands and started to understand the trending, and then we're using keywords to identify and then pull down menus to create themes. So then the other element that was really handy is the system actually color codes when you're above or below the standard, and it breaks it down by hospital type. So it's comparing apples to apples. Small hospitals have one valence, big hospitals have a separate. And if it's green, that means you're above. If it's red, it means you're below. It's beautiful. It's elegant. And it helps us immediately identify which hospitals are above and below the standards. Do you see this? You can't see this. Okay, anyway, that's a depiction of it. The red tells you where hospitals that are below, green above. So journalistically, it helps immensely to identify which hospitals are exceeding and which are below. The worst hospital in Ontario? Any guesses? sea of red on almost every metric, well below. Not Thunder Bay. GTA Hospital.
Michael Garrett.
No. No. Scarborough was by far the worst. Okay, this is the FOI real quick. It ended up being quite complicated. This is a probably fourth draft of it. Once we understood what the records are, what the actual fields are, this was the crucial part because it's filled with private information. So you have to surgically request the exact fields that you know contain public interest information without stepping too deeply into the privacy stuff that you don't need anyway, right? So it ended up being a very lengthy, detailed request. Once we perfected the language on this, it made life easy, but it took a lot of time because the initial requests lacked the type of precision needed and they led to big fights. This is some summary data. So in the end, we got 57 hospitals, 120,000 records. 2 years is the longest, but it's actually more than that because we're still fighting for 2 or 3 more, and also updating the data. That's kind of the overall trending. Let me move through this more quickly. And at the end of the day, we created the visualization with colleagues at the U of T. We're based at the U of T. Can I show that if I switch over? Will it let me do that? Yeah, cool. Okay. So we mapped it all. Here's here's Scarborough. So for each hospital, you just click on it. Shows you the trending, the keywords, and the comments are all categorized as either positive, negative, or positive and negative. So you click on any of these words, like long, and it produces all of the messages, including the word long. I waited a long time. And then similarly up here, the positive, overwhelmingly the heroes of this story are nurses. Overwhelmingly the positive comments are basically about how great my nurse was. And then this is another metric. So red means below standard. So on every one of these measurements, Scarborough is well below the standard. Okay, and then my last point here is that when they come back and say no, or sure, we're happy to give you that for $17,000, it's just a fiction. We fought every one of them, and we won every time. Meaning, not necessarily we got everything we wanted for the amount that we wanted, but in every single case when we appealed, the fees were dramatically reduced. So this is one example of the one we just got. They imposed a fee of $500. We said under no circumstances, that's extortion. And it's indefensible by any measurement. This is a download. This is 7 minutes of time. And we spent a year going through adjudication and we won completely. We said, we'll pay $150, no more, not a penny more. And the adjudicator came back and said, you're correct. So now I'm going to collect this data next week from, this is Lake Ridge Hospital. So we're going to keep updating this, and it's a resource that's on our website. It's all free. You can access it. It's for 50 hospitals, and we hope to keep expanding it and also focusing on more. We've really looked at like medical error, racism, things like this. We're going to continue looking at more of it. So that's my pitch. Happy to talk about it if you like. Thank you.